I can't emphasize enough what a great resource this organization is.
My most memorable recollection is the camaraderie and friendship that sprang up among the group.
20 years ago it was a no-brainer that NPHIC was created. I think today it's a no-brainer that NPHIC needs to be here.
I remember the small group of us from different parts of the country getting together with Don Barrett and his staff at the Centers for Disease Control and Prevention in Atlanta for the first time to launch the coalition.
I was absolutely delighted that Don Barrett of CDC invited all the state health department and PR directors to gather together and try to form an organization so that we could share information, share issues, share problems.
I felt kind of humbled among the people that I was with. They were very, very talented public health people, public health PR people from all over the country.
Peter Slocum, Nancy K. Sullivan, Shane Siren.
It really was exciting to be there with a group of public information officers from around the country.
It was a great group of people. We had never met each other before, at least I hadn't, and we became fast friends.
The vision and ideas expressed at that meeting 20 years ago marked the beginning of this outstanding national organization.
Today is March 30, 1993, and it's a beautiful spring day here in Atlanta, Georgia, where we are gathered at the CDC to discuss communications during a crisis. I'm Don Barrett, Director of the Office of Public Affairs at CDC, and I am joined...
Well, the person behind it was Don Barrett, and out of the blue, I had been in my job less than 6 months, and Don just sent a letter and said, hey, would you like to come to Atlanta to talk about better communication between the federal government and the states? And frankly, I didn't know anybody at the federal government. I didn't even know the people in Iowa, Missouri, Indiana, the people that surrounded us. So it made perfect sense for this, the organization to be put together.
At the time Don Barrett pulled us together 20 years ago, there really was nothing like this. It was remarkable to be in a room full of people doing the same kind of work that I do.
I was just relieved to have that support group and network.
They call it Don's dream, Don Barrett's dream. I think it was also Rob's responsibility. It was Rob Diefenbach who shepherded us and maybe kicked us in the butt a few times, kept us on schedule, and to him goes a lot of the credit for what has happened.
I have no recollection of the process of work we went through at CDC to create NPHIC. With a leader like Don Barrett, the memory is of the result.
I think the most important thing that was valuable to me about that NPHIC experience was the connection with other people around the country in similar jobs.
Just the relationships that you have built over the years amongst the different people in the organization.
We learned some techniques and best practices.
Being able to call people and ask them for help, in a situation that you're involved in, to share public service announcements and other material. It's been invaluable.
But it was really the process of learning how similar and dissimilar in times our jobs were and the kinds of challenges we faced.
Trying to get behavior change related to eating and trying to convince people or trying to establish the environment where people will not overeat, leading to obesity, because that leads to a whole range of problems later. I'm also concerned about the lack of support for immunizations and the growing rate of some vaccine preventable diseases.
I believe health education has not been given the national attention and public reception necessary to help prevent so many of the health-related problems facing the country, including drug use, obesity, and the spiraling cost of health care.
Where we are today comes to mind, the fact that we are all in a budget crisis, trying to keep the agency up and going.
I think the biggest challenge has been and probably will continue to be the ever-increasing demand for services at the same time that staff and resources struggle to keep up with that demand.
NPHIC started about 10 years into the first discovery of the first AIDS case, 1990 for us, And certainly that was a very difficult situation. It was, as everyone called it back then, a death sentence for anyone who contracted HIV. We've come an awful long way since then. But I think the problem that we had then, we still have today, and that is enough support, whether it's foundation, whether it's government, for the public health issues.
The biggest changer that we've had in the past 20 years is September 2001. And not necessarily the hijacking of the airplanes, but a few weeks later when the anthrax letters started surfacing on the East Coast. At that time, public health seemed to morph from assuring the health of people to assuring the health and public safety of people. So we became a whole different type of agency. We added a whole new office in our department dealing with preparedness. But it was completely different. The people that we were sitting at the table with were not our usual public health partners. We were sitting with the FBI, we were sitting with emergency management and Homeland Security, people like that normally we didn't deal with.
Few of us had cell phones 20 years ago. There was no internet. The digital age was in its infancy.
We didn't have the emails, we didn't have all of the websites, we didn't have all of the blogging.
You know, 20 years ago, you had a pretty good definition of deadlines.
I remember we used to pride ourselves on being able to respond quickly to reporters' questions. If we got the answers back within 6 hours, we thought we were doing a great job.
There were deadlines for the newspaper, afternoon papers, which there are not too many of those anymore, and morning papers. You knew when television was going on the air.
The decline of newspapers and audiences watching TV is a major change, and then the rise of diverse cable stations and use of the internet has totally changed the way we communicate and the way we reach our audiences.
Today it's 24 hours. I mean, I think we all know that. It's something you could get called at any time.
It used to be get it right first, then get it into print or on the air. Now, at least to this old media guy, it seems too often to be first get it into print or on the air, then check to see if it's right.
Today we have immediate exposure to news and information, and the evolution of social media has been phenomenal.
You have blogs and Twitters and Facebook.
And what that really means is that we are pretty much in the position of dealing with the crisis of the moment. We really don't have the luxury to look ahead as much as maybe I would like to.
In terms of public health improvements and changes, I think that the role of communication remains paramount.
I would encourage people to use the organization for sharing and networking and to improve their communication efforts, but also to let the public know what public health does and how very important it is.
I think in regards to how we started, very humble roots with Don's dream and Rob's responsibilities, as I like to call them, we have come such a long way to the point where we're now a staffed organization. We say we, I'm retired, but you folks. And I think you need to appreciate some of the things that went before, the rudimentary elements that we started with, and now you've got staff and support, and I think you need to appreciate that and appreciate the camaraderie that you have with being able to communicate on a regular basis important issues among the 50 states and the territories.
I can't emphasize enough what a great resource this organization is, especially for new members. It's hard to believe now that there was a time when this didn't exist. I think back to last year, the H1N1 outbreak, and I can't imagine going through that without the resources that NPHIC brought to bear for all of us. I can personally say that I'm grateful to Don Barrett for bringing us all together. He had the vision and the will to make this organization a reality, and I think that has made all of our jobs much, much easier to do.
Enjoy your work. It's often demanding and often difficult, but it's important and it should be fun too. Good luck to you all, ladies and gentlemen. Keep putting out those fires.